Hello, everyone. Welcome to Grey Matter, your one stop shop to all your exam preparation needs. As you know, we have been discussing the various domains of the UKMLA, and we are finally getting really close to the end. Today, we are going to discuss a very important and one of the most frequent coming scenarios in the exam, and that is the medicine of older adult. So, usually, this is a station that will come in your exam, at least a single station that will come in your exam, in which the patient is of increased age, he is old, and there are various diseases and various presentations that are limited to that age, and you have to carry out the diagnosis accordingly. So, first of all, is the abnormal involuntary movements. A patient can present due to any abnormality in this movement, like it can present with the gait of the patient is abnormal, such as in Parkinson's disease, or it can be any cerebellar defect, and there can be any rigidity, there can be tremors. So you need to denote all of that, and you need to carry out the proper neurological exams to denote the cause. So the second is auditory hallucinations. Again, this is one of the symptoms that the patient can present with, and it can be due to number of causes. It can be due to any extrapyramidal effect. It can be due to the drug he's taking. It can be due to any psychological issues. So you need to find out the cause. Blackouts and faints. This is a very common presentation, especially for older patients. Usually, it happens due to it can happen due to the medications that the patient is taking. It can be due to the side effect of one of the medications, and this is a particularly new topic. It is particularly new scenarios that has been coming now in by the GMC. Chest pain, you all know, we have discussed it in detail in the cardiology section. The patient can present with normal chest pain. You need to find out what's the cause. It can be, you need to rule out angina, you need to rule out MI. Confusion, now the patient presents to you in a confused state. You need to do the MMSE, the mini mental state exam, to find out what's the cognitive level of the patient, and you need to find out if the patient is under the influence of some drug. But before that, in an older patient, the mini mental state exam is essential and important in order to find out what's the cognitive functional level of the patient. Constipation, a very common complaint of older patients. You need to rule out if it's absolute constipation. You need to, mostly this occurs in the form of a examination station, a combined station. So you need to do the examination of the abdomen. You need to offer the digital rectal examination, or it can be an examination station in which you have to do PR. Dizziness, we have discussed it in detail. It can be due to medicinal cause, or it can be due to any ENT cause. Driving advice, usually it comes as the form of patients suffering from any number of diseases, such as stroke or MI, and or post surgery, and then you have to advise them whether to inform DBLA or not. Elder abuse, which is a very favorite topic of UKMLA. Elder abuse, the patient comes with various fractures or bruises on the patient, and that is not explained by the symptoms that the attendant is giving. So you need to ask the attendant carefully and skillfully to find out if the patient is being abused. Electrolyte abnormalities. Now, this can come due to a number of diseases. So, in the electrolyte abnormalities section, you are going to be given test results, and in which the old person, maybe he's having a routine blood test, or maybe he had some symptoms for which he was given blood results, and the blood results show any number of electrolyte abnormalities, and you have to deal with the patient accordingly. Now, the fecal incontinence, that is also an important topic. Mostly it comes in the surgical portion. Again, you have to do the PR, you have to do the abdominal examination, you have to um, take the whole history regarding that. Falls, a very important topic. Patient presents with a fall. It results due to postural hypertension or due to the different medications that the patient is taking, and you have to rule out all the other causes before reaching that. And frailty, we have already discussed before. Hearing loss, we have discussed before. It can be age-related hearing loss. Hypertension, you all know about hypertension. A patient comes with high blood pressure and how you have to deal with the patient. This mostly comes in the form of a counseling station. Immobility, the patient is immobile, and how you have to counsel the patient about the bed sores and the complications that can arise. Memory loss, this can is the scenario that is coming in the UKMLA is due to drug side effect, so you have to deal with that. Mental capacity concerns, daughter or a son will come and say that he's worried about mother's or dad's mental capacity, and you have to do a mini mental state exam for that case. Peripheral edema, ankle swelling, it can be due to CCF, it can be due to CKD. Rule out these causes. Skin ulcers, it can be due to diabetes or it can be due to peripheral arterial diseases. Struggle to cope at home, a patient is living alone and he's psychologically distressed, and it's basically a counseling station. Trauma, it can be due to any number of causes. Urinary incontinence, again a surgical case. Urinary symptoms, again you have in both of these cases you have to ask all the questions regarding the waterworks, the history of complete history that you're going to read in the bladder section or the prostate section. Vertigo, we have already discussed in the previous videos. Visual hallucinations, it can be due to any drugs, it can be due to psychological issue or any organic cause. So you have to rule these things out through your history. And so these none of the topics here are anything new that has been added by the UKMLA. All the topics were present in the PLAB section. Benign proximal positional vertigo, we have talked about it in ENT section. Cardiac failure, we have talked about it. Delirium, we have talked about it. Dementia, we have already talked about it here. It can be due to any drug or age-related. Hypothermia and hypothermia, we talked about it in the previous videos. Lower limb fractures, we have talked about it now. The malnutrition, it can be due to any. It can be the patient is not able to cope at home. He's living alone, or it can be due to NAI. It can be due to abuse. The patient is malnourished, so you have to rule out abuse in that case. NAI, this is very important. The UKMLA GMC loves NAI. Remember that. So you have to read this topic very carefully. Osteoporosis or a bone scan and normal test of the vitamin levels, and it's age related. Parkinson's disease, we have talked about it, of abnormal involuntary movements. Pressure sores, the patient is bedridden. Stroke, again this comes as a counseling session. And urinary incontinence, we have already talked about it. So pretty much, as you know, these topics have been covered in the PLAB section. So you're not going to find any new topic that has been introduced by the GMC in the UKMLA section. So I'll see you guys